Over the past several months, we've introduced a number of incredible individuals who are part of the team at U of L Health. Today, we're joined by Dr. Victor Van Berkel, a cardiovascular and thoracic surgeon at U of L Health. We're happy to have you joining us this morning, Dr. Van Berkel. Now, what conditions do you and your team treat at U of L Health?
Angie. Well, thank you very much for having me. Yeah, as you mentioned, I'm a thoracic surgeon. I'm in the Department of Cardiovascular and Thoracic Surgery, but mostly what I focus on are really things within the chest. I work mostly on the lungs and on the esophagus, which means in Kentucky, the vast majority of what I do is operate on lung cancer.
Absolutely. Now, COVID obviously changed life for all of us, and it's caused some people really to hesitate before seeking medical care. And what are symptoms that people should not ignore right now? And then this is a twofold question. What are you doing to keep patients and, of course, staff safe during the pandemic?
Sure. This has obviously been a very difficult and a strange year for everybody. Um, and there's always a balance of trying to figure out what is the safest thing to do. When do you come to the hospital and when do you try to be safe at home? Anytime that you have trouble breathing, I think that that is something that requires medical attention. If you feel like you're unable to catch your breath or you're really struggling to do things you would normally, coming in and getting somebody to take a look at you is going to be very important.
Absolutely.
There's one thing that we have found with COVID is that it sometimes people can go from being okay and not too bad to being very sick very quickly. And so, if especially for elderly population, if someone is a little bit on the older side or has trouble with their breathing at baseline and they start really starting to notice something is different, please come in and have somebody take a look at you. In the hospital, you mentioned what are the things that we're doing to kind of keep each other safe and keep both other patients and the other practitioners safe. The most important thing, obviously, is that when you're coming to the hospital, they're going to have you wear a mask and try to be very careful about washing your hands and not having contact with other people. In the hospital, we are limiting the number of visitors that are allowed to come in with a patient at any time. We're limiting that to one person currently, although that has changed sometime over the last couple of months. We did have a period where nobody could come in. I guess maybe the right thing to say is who knows what it'll be like a month from now. But we are, one of the other things we're doing is for the patients that are in the hospital that are COVID positive, of which we have a few, those are all cohorted away from everyone else. So they're on a different floor with different nurses. They won't be around any of the patients who are not COVID positive. Also, if you're getting admitted to the hospital, you're going to get a COVID test. We need to check and make sure that you are not an asymptomatic carrier of the virus before we put you in on the floor with everybody else. So those are some of the things that we're doing.
Dr. Van Berkel, I wanted to ask about this. I mean, we saw people, I mean, it's been 6 months and growing, and continuing. We saw people, I mean, very, very tentative in terms of whether or not they were going to seek medical care for a variety of things. But now that we're, I mean, this far past, I mean, are people, do you see the majority of people who are finally saying, okay, I can safely do this. I do need to go and get these symptoms checked out. Is it better? And we're still trying to get the word out?
Well, I think that there is. I guess we are catching up a little bit in
Mhm.
terms of the backlog of patients because you're right, and I understand this. People didn't want to go into their primary care physician or go get referred to see somebody. Unfortunately, even with all this stuff that's going on with the coronavirus, cancer doesn't stop and heart disease doesn't stop, and all of these other problems that are already percolating along in our community continue to be a problem. One of the things we're seeing right now in the hospital is we have a lot of very sick people in the hospital, not because of coronavirus, but because they had other issues that were put off for a long time because they were afraid to come in and see somebody. And so I think, the your risk, for example, of having colon cancer and needing a colonoscopy, that's still there, even though the coronavirus is going on. And so I think that it's important for people to do what they can. And I know a lot of physicians' offices, and our office is the same. A lot of physicians' offices are doing telehealth visits just to kind of check in with people, so you don't actually have to come to a clinic or come to the hospital and be around other people, but you can still be seen by a physician or one of the physician assistants to kind of check and make sure that you're doing okay. And all of this we all have to figure out a way to kind of keep going forward, even though the coronavirus is causing all of these different problems.
Was just talking about that with a colleague, just with the various people we've talked with. I mean, we all have to remember COVID-19 is not the only thing that's out there.
Yeah.
People need to call people. They need to call UofL Health. Now, in your specialty, though, you have seen some of the sickest of the sick COVID-19 patients, and you've used a device that a lot of us have either read about or maybe heard about, ECMO, spelled ECMO, to try and help them. Can you tell us what is ECMO and how is it being used?
Sure. So ECMO it's an acronym that stands for kind of a mouthful. It's extracorporeal membrane oxygenation. And what it is it's kind of the way to think about it is it's sort of like a heart-lung bypass machine. So if someone was having a heart operation and we put them on bypass to be able to work on them, this is something that is similar to that. Essentially what it does is, as I think everybody knows, like if you have a bad respiratory infection, if you have a really bad COVID infection, one of the first thing that happens is you get put on extra oxygen to help you. If that's not enough, sometimes you have to go on the ventilator, where we put a breathing tube in and we have a machine that does the work of breathing for you. Unfortunately, sometimes even that is not enough. And even with the ventilator, the lungs are so damaged that they can't exchange enough oxygen. And so then the safest thing to do is ECMO, which is where we basically put a large cannula into a large vein, and we draw the blood out, run it through a machine that oxygenates the blood for us, and then we put it back into the patient and have the patient's own heart circulate that blood around. So it's a way of basically doing all of the work of the lungs outside of the body. Now, it's important to remember this doesn't actually cure you of the coronavirus. This doesn't actually treat the problem. All it's doing is buying us time and giving the lungs a chance to heal and giving your body a chance to get rid of the virus, but making sure that your body has enough oxygen to be able to survive while that's going on.
Speaking of equipment, Jewish Hospital is upgrading 3 cath labs, which will include a new Da Vinci Xi robot. How beneficial are these upgrades for both patients and physicians? And also, can you just briefly explain what is a Da Vinci Xi robot?
Sure. So those two things. So unfortunately, those two things actually have nothing to do with one another. So the cath lab, the cardiac cath lab, that's right. They're upgrading a lot of the equipment in the cath lab to allow the cardiologists and the cardiac surgeons to do the most up-to-date procedures for people who have either coronary artery disease or valvular disease, allowing them to be more accurate from a diagnostic standpoint, but also to do some of these minimally invasive procedures like TAVRs. The Da Vinci robot, the Xi, is a robotic assistant for doing minimally invasive operations, and it's a way for us to do. So I use it, for example, to do lobectomies, to take out parts of people's lungs that are involved with cancer. It allows us to use very small incisions, usually 8mm incisions, that we go in with a camera and with the arms of the robot to be able to do kind of a very delicate dissection inside the chest without having to get my hands all the way in there. And so it's a way of doing complex operations in a minimally invasive way. And that means that patients usually have less pain. They can get out of the hospital faster and can get back to their normal lives in a much faster time frame.
Definitely beneficial, that's for sure. Now, lastly, Dr. Van Berkel, we're coming up on the 1-year anniversary of UofL Health. How beneficial has just the growth been for not just you as a doctor, but for the care that's provided to our community?
Sure. So this has been this 2020 has obviously been a horrible year for a lot of people, but from the point of view of the healthcare within Louisville, I think that this has been a really good year for us. The medicine is getting more and more complicated as years go on, and it's becoming more and more of a team effort to really take care of people. And For that to happen, you need to have all the different players on the team. You need a good medical service, you need a good surgical service, you need a good anesthesia team. And by joining up university with Jewish Hospital and all of the former kind of Kentucky One parts, we now have a lot more players that can help us take care of any one patient. I think the ability to have all of these different specialties involved with someone as they need it, the growth of our multidisciplinary boards for helping take care of cancer patients, for example, all of these things are important both to the individual patient, but also to the community. I think that it allows us to elevate the standard of care and really provide the best care for our patients.
Absolutely. Dr. Van Berkel, I know you're very busy. Thank you so much for taking the time.
No problem. And thank you very much for having me here.
To learn more about UofL Health and find a physician or specialist, just visit uoflhealth.org.